if they need to self-isolate for 14 days. In terms of the actual borders between Manitoba and Quebec, there are 43 different road pathways through Quebec and Manitoba, and we want to check those visitors. Why are you coming into Ontario at this time? Is it necessary for medical, personal, and work reasons? And if it's not, respectfully, you need to turn away until we deal with the variants, until we get sufficient vaccines to make sure that our citizens are protected. Thank you.
And just one more thing. You know, and I don't think I've ever mentioned this before. Do you know who our heroes are too? Along with the firefighters, paramedics, our police, our Canadian Border Protection officers. You know, no one talks about them. Imagine being there every day and having 36,000 people come to you in a week, and they need to be protected too. You know, they're on the front lines, the first of the front line to protect our country. So I want to say to the Canadian Customs officers, I have your backs. You guys are champions, and they need to be protected. And if the federal government doesn't get them vaccinated, we need to, because they're facing really tough challenges with people coming from all over the world, you know, face to face, literally. So I got to give a shout out to our customs officers. I have your back, and we'll make sure one way or another we'll get you vaccinated, because they're a priority, essential service.
Last question.
Alison Martel at Reuters. Thank you.
Hi, Alison.
So it looks at this point all but certain that Ontario will still soon have more critically ill COVID patients than ICU beds. That means people will have heart attacks, they will be hit by cars, they will catch COVID at work, and they will receive substandard care, or maybe only limited care to keep them comfortable while they die. Why not close some non-essential manufacturing and distribution workplaces now and reduce that death toll?
Okay. You know something? When we talk about the non-essential manufacturing, you look at the supply chain. The supply chain is so deep. You know, you can pick one and not the other. The supply chain is deep. And do you know who I wish was here is Vic Fideli. He was talking about the forestry. You know, someone said, why don't you close down the forestry? There's a product in the forestry that is in aspirins and dozens and dozens of different products. And, you know, someone that makes a light switch. I could go on and on and on. What we need to do, I'll tell you what we need to do. First of all, we need to make sure the mobility stops. We have to make sure that we get the vaccines into people's arms. We need to make sure that we enforce the stay-at-home order. It works, folks. That's what we need. We need that more than anything. The bottom line is, this is the bottom line. Would we be in this position if we were getting 300,000 vaccines back in February, like the rest of the world? The answer is absolutely not. We wouldn't be facing the crisis with ICU. We wouldn't be having shutdowns. We wouldn't have the schools shut down. We need the vaccines. And, you know, whatever, hook by crook, whatever, the feds need to get us vaccines. Bottom line.
Follow up?
That's Premier Doug Ford speaking to the province today. I'm Jill Deacon. You've been listening to a live province-wide special, bringing you the Premier, the Solicitor General, the Health Minister, and so on, talking about new measures that are in place for the province. The stay-at-home order has been extended by another 2 weeks, for bringing it to a total of 6 weeks. Outdoor gatherings are restricted to just members of your household. Non-essential construction is now closed. Big box stores will be reduced to 25% capacity. A lot of restrictions announced today. Rob Benzie has been standing by, listening along with me, Queen's Park Bureau Chief for the Toronto Star. Rob, we just have a couple minutes left till the top of the hour. Just as best you can in that time, what's your response to these new restrictions announced today?
Well, these are some very serious things that are being done, Jill. I mean, we're going to have random police checks for Ontarians. We used to call this carding. Now police have the authority to stop and ask you why you aren't near your house and to show proof of your identification. That's going to be problematic. And we've seen in the past, the Canadian Civil Liberties Union has already called this, a few minutes ago, called this an egregious violation of civil liberties. We're going to have checkpoints installed on the Quebec and Manitoba borders, and playgrounds and golf courses are going to be closed. So there's a lot to absorb. The Premier has just made this very grim announcement after these admittedly very scary projections about the infection rates and where we're headed. I mean, we're already at ICU capacity, at full capacity almost, and they're worried about blowing through that. And I understand why they're doing it, but some of these restrictions are going to be seen as pretty draconian, Jill.
Mm-hmm. And how in line are they with what's being recommended by public health doctors? I've been tracking some response from various infectious disease specialists on social media throughout this, and there's a sort of a range of response to this. How in line would you say these recommendations are with public health advice?
Well, some of them are greeted, are welcome. To some, like the curbs on outdoor activities, like closing playgrounds and golf courses and basketball courts outside. That some doctors are saying that's not really a good idea because people should be getting healthy exercise outside. But other things are welcomed. Of course, the big thing is why. The big question a lot of people are asking is why didn't the government do this 2 months ago or 1 month ago?
Indeed, there's certainly a lot of follow-up to come. We'll try to parse this, as I know you will, in your work at the Toronto Star as well. Rob, thanks so much for being with me this afternoon and for all your thoughts.
My pleasure, Jill.
That's Rob Benzie, Queen's Park Bureau Chief for the Toronto Star. I'm Jill Deakin. You've been listening to a province-wide special here on CBC Radio 1, announcing much extended restrictions to stay-at-home orders for Ontario. Expect to hear reaction on your local programs, which come your way right after The World This Hour.
From CBC News, The World This Hour, I'm Josette Lafleur. People in Ontario now face a new slate of strict COVID-19 restrictions.
I've never shied away from tough decisions. And today, I'm here to do just that.
The province's Premier Doug Ford speaking this hour and extending a province-wide lockdown to a total of 6 weeks. It's an attempt to slow down an alarming spike in COVID infections.
We're losing the battle between the variants and vaccines. But if we dig in, remain steadfast, we can turn this around.
Ford also announced several other measures, including checkpoints at interprovincial borders, the closure of all non-essential construction, and authority for bylaw and police officers to enforce the rules. Ford's announcement comes as Canada's most populous province recorded another record high for COVID cases, and after the release of alarming new modeling that shows cases in Ontario could rise as high as 15,000 a day. Our Laura McQuillan has the details on that part of the story.
There's no silver bullet in any of this. There's no single measure we can put in place.
A dire picture painted by one of Ontario's top science advisors. Releasing new provincial modelling, Dr. Adelstein Brown says a 6-week stay-at-home order with stronger restrictions is the bare minimum needed to get the third wave of the pandemic under control. And key to that, he says, is vaccinating essential workers and people living in COVID hotspots, many of whom are still waiting to hear when they'll get their shot.
Doubling down that vaccination into the highest risk communities, that's where the most cases are right now, and it's because of the risk of exposure.
Brown warned that the number of COVID patients in intensive care is expected to climb for weeks to come before further restrictions have any impact. Laura McQuillan, CBC News, Toronto.
The Prime Minister is promising a bigger vaccine shipment to Canada to make up for a shortfall in deliveries from Moderna. Justin Trudeau says Pfizer has agreed to increase its COVID-19 vaccine supply to the country.
With the new deal, Canada will receive 4 million additional Pfizer doses in May, another 2 million in June, and 2 million more in July. For next month alone, this will come out to about double the Pfizer doses we were originally expecting.
Moderna was poised to send 1.2 million doses to Canada this month, but news came today that shipment has been cut back to just 650,000 shots. In Nunavut, authorities have declared an outbreak of COVID-19 in Iqaluit. The territorial capital reported 12 more cases today. The city is now bracing for the case count to rise. Nick Murray reports.
The new cases announced today in Nunavut's capital has locked down the city. Iqaluit only confirmed its first case on Wednesday night since the pandemic began. Since then, more cases have been found through contact tracing. Yesterday, officials announced a local bar has been identified as a hotspot of cases, but today the chief public health officer said All positive cases so far have links between them. Although Michael Patterson said the risk is low to bar patrons, he pleaded with the city's 8,000 residents to stay home this weekend. As temperatures warm and the sun shines for 14 hours a day, this is prime time in Iqaluit for snowmobile outings on the land. Moderna's rollback of its vaccine delivery to Canada won't affect Nunavut. Last month, the territory received its full allotment of the doses, enough to vaccinate 75% of Nunavut's adults. Nick Murray, CBC News, Iqaluit.
In international headlines, the Kremlin has announced counter-sanctions against the United States. Russia will ask 10 U.S. diplomats to leave the country. Retaliation for Washington's announcement of sanctions yesterday. The U.S. expelled 10 Russian diplomats over alleged election interference, blacklisted several Russian companies, and barred U.S. banks from buying sovereign bonds from Russia's central bank. And that is the world this hour. For CBC News, I'm Josette Lafleur.
Thanks, Josette. I'm Jill Deacon. It's 10 degrees in Toronto this Friday afternoon. You're listening to Here and Now. The modeling numbers forecasting the weeks ahead are pretty impossible to wrap your head around, and as a result, we heard some strict and some say severe response to those numbers. An extension of stay-at-home orders announced this afternoon by Premier Ford. We'll find out more about what difference today's new measures will actually make. We'll also talk about turtles. Attention drivers, turtle crossing. Take it nice and slowly these days if you're anywhere that a turtle might be found. I know that sounds random, but it is a force of nature that turtles don't pay attention to stay-at-home orders, and they are something you need to know about. Their movements could affect yours in the days ahead. All right, let us look at the movement around our city this afternoon. Khalil, how's it looking?
Well, Jill, we still have this collision blocking the South 427 ramp to Holiday Drive. You're going to find that the highway itself degrees right now. We're starting to see the temperature drop a little bit. Rain showers is pushing actually from the east to the west, which is contrary to what we usually see. Over the last couple of hours, we've seen it move from Ajax towards Scarborough now, and actually probably just starting to see it in the downtown core as well. That's going to last through the evening hours tonight. So look for spotty showers this evening. Overnight tonight,